You're alone, perhaps tending your garden or sipping coffee, when a sudden, uncomfortable feeling hits you, perhaps a tightness in your chest, or a feeling of extreme fatigue that makes you feel like something isn't quite right. It could be your heart giving you a warning, and in those moments, knowing what to do could save your life. Hi, I'm Dr. Emily Harper, a cardiologist with over 30 years of experience helping older adults thrive. Welcome to Philosophy for Aging, where we empower you with the knowledge to face life's toughest challenges. Today, I'm going to share 7 key steps to surviving a heart attack when you're alone. Because here's a sobering truth. Nearly 2/3 of older adults over 60 are alone when they have a heart attack. And too many lose their chance of survival due to hesitation or confusion. Join me as we explore these proven, practical actions that could be the key to getting you through those crucial first few minutes. Tip 1. Call 911 right away and never try to drive yourself to the hospital. When you suspect a heart attack, every second matters. And getting professional help fast is your top priority. For seniors, this step is especially vital, as hesitation or the wrong choice can make a dangerous situation worse. Calling 911 ensures help is on the way, while you focus on staying calm and safe. Let me tell you about Harold, a 74-year-old patient of mine. Last fall, he felt a strange pressure in his chest and trouble breathing while reading in his living room. Thinking he could tough it out, he decided to drive himself to the hospital. Halfway there, his symptoms worsened, and he nearly passed out. Swerving into oncoming traffic, a passerby called 911, but the delay and stress of driving cost him precious time and added injuries. Harold later said, "I thought I was saving time, but I almost lost everything." His story shows why driving is a risky mistake. Why is calling 911 so important? First, every minute without treatment during a heart attack damages your heart muscle more. Studies show that after just 10 minutes, the harm can start to become permanent. Second, driving puts extra strain on your heart. The stress of navigating traffic increases your heart's workload when it's already struggling. Third, if you lose consciousness while driving, you endanger yourself and others on the road. Most importantly, when you call 911, treatment starts the moment. Paramedics arrive. Ambulances are like mobile emergency rooms. Equipped with life-saving tools like defibrillators and medications, they also notify the hospital, so a cardiac team is ready when you get there. Here's exactly what to do if you're alone and suspect a heart attack. First, stop what you're doing and sit or lie down in a comfortable position to reduce strain. Next, dial 911 immediately. Don't worry about being wrong. Let the experts decide if it's a heart attack. Clearly tell the dispatcher, "I'm a senior with possible heart attack symptoms." This helps them prioritize your call. If you can, unlock your front door so paramedics can get in. Even if you become unresponsive, if you have a medical alert device, like a pendant or smartwatch, press it after calling 911. These devices can connect you to someone who stays on the line until help arrives. What about calling a family member or neighbor first? It's tempting, especially if you feel scared or want someone familiar. But this causes delays. Always call 911 first. Then reach out to loved ones if you're able. I've seen patients wait to call a son or daughter, only to lose critical minutes while waiting for a response. Professional help is your fastest path to safety. Harold's close call taught him a hard lesson, and he now keeps his phone and medical alert device within reach at all times. He also practiced unlocking his door quickly, a small step that could save time in an emergency. These actions are simple but powerful, and they can keep you alive until help arrives. Have you thought about what you'd do if you had heart attack symptoms while alone? Do you have a phone nearby or a medical alert system? Share your thoughts or plans in the comments below. Your ideas could inspire others to prepare. Calling 911 first isn't about overreacting. It's about giving yourself the best chance to survive. In the next tip, we'll talk about a common household item you can use to boost your survival odds while waiting for help. But only if you use it the right way. Tip 2. Learn to spot the warning signs of a heart attack in seniors. These signs often catch people off guard because they don't match the dramatic image most of us have in mind. You might imagine someone clutching their chest in intense pain, like in the movies. But for those over 60, the reality can be far less obvious. This is especially true for women. Studies from the American Heart Association reveal that about 40% of seniors experiencing a heart attack never feel that classic, crushing chest pain. Instead, they notice subtle, easy-to-miss symptoms that can be mistaken for something else entirely. Ignoring these could cost you precious time and, potentially, your life. Let me share the story of Evelyn, a 78-year-old patient I worked with last year. She nearly dismissed her heart attack because she only felt an overwhelming sense of tiredness and a slight, nagging dizziness. She thought she'd just overdone it while sorting through old photo albums. Fortunately, her son was visiting and recognized that something wasn't right. He called 911 immediately, and that quick action saved her life. Evelyn's experience underscores why knowing these unique symptoms is so vital for seniors. Here are 7 critical warning signs you need to memorize. First, sudden, extreme fatigue that feels out of place. This isn't the usual weariness after a busy day. It's a deep, heavy exhaustion that hits without warning. Second, shortness of breath, even during light activities or while sitting still. If you suddenly struggle to breathe while doing something as simple as walking to the front door, pay attention. Third, unexpected sweating that's cold and clammy, not related to heat or physical effort. You might feel damp or chilled for no apparent reason. Fourth, nausea or upper stomach discomfort that mimics indigestion. Many seniors assume it's a digestive problem, but it could be your heart. Fifth, dizziness, lightheadedness, or even confusion that comes on suddenly. For some, confusion is the only clue something's wrong. Sixth, discomfort or pain in areas beyond the chest, such as your jaw, neck, back, or either arm. This pain might feel like a dull ache or pressure rather than sharp agony. And seventh, unusual sleep disturbances or increasing fatigue in the days or week before a heart attack. Research shows many seniors experience these early warning signals up to 7 days prior. A special note for women over 60, you're more likely to experience these less obvious symptoms, like fatigue, nausea, or shortness of breath. Instead of clear chest pain, this makes it tempting to shrug them off, but that's a risk you can't take. I recall another patient, Ruth, who felt unusually tired and slightly nauseous for a few days. She blamed it on a flu bug until a strange ache in her neck prompted her to seek help. Acting quickly made all the difference for her survival. Stories like Ruth's highlight why you must listen to your body. If you notice any of these symptoms, don't hesitate. Don't convince yourself it's nothing or that you'll feel better after a rest. In my 30 years as a cardiologist, I've seen too many seniors delay because they didn't trust their instincts or feared overreacting. But every minute you wait increases the danger. Acting fast is your best chance to get through a heart attack, especially when you're alone. Have you ever felt symptoms like these and brushed them aside? Or maybe someone you know has. Share your story in the comments below. It could inspire others to take action. Your experience matters. In the next tip, we'll cover what to do the moment you suspect a heart attack, so you can get help as quickly as possible. Knowing these warning signs is your first step to staying safe, and it could be the key to surviving when no one else is around. Tip 3, take aspirin correctly. When you suspect a heart attack, every moment counts. And using aspirin the right way can help protect your heart until emergency help arrives. But it's not just about popping a pill. How, when, and what you take makes all the difference in its effectiveness. Let me tell you about Grace, a 69-year-old patient I treated last year. While watering her plants alone one evening, she felt an odd pressure in her chest and a wave of nausea. Recalling a conversation we had, she grabbed an aspirin but swallowed it whole with a full glass of water, thinking that was enough. That choice slowed the aspirin's effect, delaying its ability to help her heart. Later, Grace told me, "I was shocked to learn I did it wrong. I thought any aspirin would work fast." Her story highlights why the right method is critical. Why is aspirin so important during a heart attack? Most heart attacks occur when a blood clot blocks an artery, cutting off oxygen to your heart muscle. Aspirin works by preventing blood platelets from sticking together, which can stop the clot from growing larger. According to research in the Journal of the American College of Cardiology, taking aspirin correctly during a heart attack can reduce mortality by up to 23%. But to get that benefit, you need to follow the proper steps. Here's exactly how to take aspirin if you think you're having a heart attack. First, after calling 911, take 325 milligrams of aspirin immediately. That's typically one full-strength adult aspirin or 481 milligram baby aspirins. Second, I don't swallow it whole. It takes too long to start working. Instead, chew the aspirin thoroughly before swallowing. Chewing gets it into your bloodstream in about 5 minutes, compared to 30 minutes if swallowed whole. Third, and use just a small sip of water to wash it down. Too much liquid can slow how quickly it's absorbed. Finally, inform the 911 dispatcher and paramedics that you took aspirin, including the dose and time. This helps them tailor your care when they arrive. There are key cautions to keep in mind. If you have an aspirin allergy, a bleeding disorder, are on blood thinners, or your doctor has advised against aspirin, do not take it. Also, only use actual aspirin, not other pain relievers like ibuprofen, acetaminophen, Advil, or Tylenol. These don't have the same blood thinning effect and won't help during a heart attack. I recommend all my patients over 60 keep aspirin in easy-to-reach places: your bedside table, kitchen, purse, wallet, or car. In a crisis, you don't want to waste time digging through drawers. Grace was fortunate. Despite her mistake, paramedics reached her quickly, and she recovered with minimal heart damage. Now, she keeps aspirin in several spots around her home and knows to chew it if symptoms return. This small change could be a game changer in an emergency. Was the idea of chewing aspirin during a heart attack new to you? Did you know this technique before? Share your thoughts in the comments below. Your input could inspire others to be ready. Aspirin isn't a substitute for professional medical care, but it's a vital step to take while waiting for help. It's like a temporary shield for your heart until paramedics can take over. In our next tip, we'll explore how to position your body while waiting for emergency responders. It's a step many people get wrong, and it can significantly impact how well your heart holds up during those critical minutes. Stay with me to learn how to maximize your chances of survival when you're alone. Tip 4. Position yourself correctly to survive a heart attack. How you hold your body while waiting for help can ease the strain on your heart and improve your chances of making it through those critical minutes. For seniors, this is especially important, as your heart and lungs may already be working harder. Getting this right can make a real difference when you're alone. Let me share the story of Raymond, a 75-year-old patient of mine. One morning, while reading the newspaper alone, he felt a sudden shortness of breath and a heavy sensation in his chest. Thinking back to a television show, he lay flat on the floor, hoping it would help. Instead, his breathing became harder, and his heart felt more strained. When paramedics arrived, they quickly sat him up, which eased his symptoms. Raymond later told me, "I thought lying down was the best thing. but it made everything worse. His experience shows why the right position matters. So, what's the best way to position yourself during a suspected heart attack? It depends on your symptoms. If you're struggling to breathe, which is common for seniors, sit upright with your back well supported. In what doctors call the high Fowler's position, keep your knees straight or slightly bent. This helps your lungs expand fully, reducing your heart's workload and boosting oxygen flow. If you feel dizzy or lightheaded, a slightly reclined position is better. Sit at about a 45-degree angle with your head and back supported. This keeps blood flowing to your brain without overtaxing your heart. If nausea is a major symptom, sit upright and lean slightly to your left side. This can help prevent choking if you vomit. Whatever position you choose, avoid extra strain. Don't stand, walk around, or exert yourself while waiting for help. Stay still in a stable spot where you won't fall if you get dizzy or pass out. Another key step is to loosen any tight clothing, especially around your neck, chest, or waist. Unbutton a collar or loosen a belt to make breathing easier and improve blood flow. Temperature matters too. Heart attacks can cause cold sweats, and seniors are sensitive to chills. If you feel cold, cover yourself with a blanket to avoid shivering, which puts more stress on your heart. Where should you position yourself in your home? Ideally, I choose a spot near your unlocked front door so paramedics can find you quickly. If you're upstairs when symptoms start, don't try to go downstairs. The effort could worsen your condition. Instead, call 911 and tell the dispatcher exactly where you are. Like, I'm in the upstairs bedroom. For example, one of my patients keeps a chair near her front door for emergencies, a habit that saved her time during a scare last year. Raymond's close call taught him to prepare differently. Now, he knows to sit upright if symptoms return and keeps a blanket nearby. These small changes could be vital in a crisis. I urge all my patients to think about their home layout and practice these steps, so they're ready if the worst happens. Have you considered where in your home you'd wait for emergency help during a heart attack? Do you have a spot in mind, like near the front door? Share your thoughts in the comments below. Your ideas could help others plan ahead. Positioning yourself correctly isn't a cure, but it's a smart way to support your heart while waiting for paramedics. It's like giving your body a better chance to hold on until professional care arrives. In our next tip, we'll cover a technique to manage panic and pain during a heart attack. It's a simple tool that can calm your mind and ease your heart's burden, especially when you're alone. Stay with me to learn how to use it effectively. Tip 5. Control your breathing with the 4-7-8 technique. When a heart attack hits, your body's natural response is panic, which spikes your heart rate and makes breathing shallow. For seniors, this stress can worsen your heart's condition, reducing oxygen when it's needed. Mastering this simple breathing method can ease strain and help you stay focused while waiting for help. Let me tell you about Eleanor, a 72-year-old patient of mine. One evening, while watching television alone, she felt a heavy pressure in her chest and a wave of fear. Her instinct was to panic, but she remembered a breathing exercise we discussed. By focusing on the 4-7-8 technique, she calmed her racing heart and felt more in control until paramedics arrived. Eleanor later said, "That breathing gave me something to hold on to. It kept me from spiraling." Her story shows how powerful this tool can be. The 4-7-8 technique, developed by Dr. Andrew Weil and backed by cardiovascular research, is easy to learn and needs no equipment. Here's how to do it during a suspected heart attack. First, get into a comfortable, supported position, like sitting upright as we discussed earlier. Place the tip of your tongue against the ridge behind your upper front teeth and keep it there. Start by exhaling completely through your mouth, making a soft whooshing sound. Next, close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. If that's too hard, especially if you're short of breath, hold for as long as feels okay, even if it's just 2 or 3 seconds. Then, exhale slowly through your mouth for a count of 8, making that whooshing sound again. Repeat this cycle at least 4 times or keep going until help arrives. Why does this work? The long exhale triggers your parasympathetic nervous system, which calms your body's fight or flight response. This can lower your heart rate, ease blood pressure slightly, and improve oxygen, use crucial benefits during a heart attack. Studies in the Journal of Emergency Medicine show that controlled breathing can cut pain perception by up to 28% during cardiac events. For seniors, it's especially helpful because it reduces adrenaline, which lightens the load on your stressed heart. Plus, focusing on your breath gives you a sense of control in a scary moment, helping you think clearly and communicate with paramedics when they arrive. Eleanor's success with this technique wasn't a fluke. I've seen many patients use it to stay calm and buy time until help came. It's a tool you can practice now, so it's second nature if you ever need it. Try it during stressful moments to get comfortable with the rhythm. The more you practice, the easier it'll be to use in a crisis. Have you ever tried a breathing technique to manage stress or anxiety? Maybe during a tough moment or even a medical scare? Share your experience in the comments below. Your story could inspire others to try it. This technique isn't a substitute for medical care, but it's a practical way to support your heart while waiting for paramedics. It's like a mental and physical anchor to keep you steady when you're alone. In our next tip, we'll explore a controversial technique for extreme situations. Something you'd only use if you're losing consciousness and help hasn't arrived. It's a last resort, but knowing it could give you a fighting chance. Stay with me to learn what to do in those critical moments. Tip 6. Self-administer chest compressions if necessary. This isn't traditional CPR, which you can't do on yourself, but a modified technique for when you feel consciousness slipping away. It's a debated method in medical circles, with some experts cautious about teaching it. However, after 35 years as a cardiologist, I believe seniors deserve to know every tool that might give them a chance to survive those desperate minutes. Let me share the story of George, a 74-year-old patient of mine. One quiet evening, while tinkering in his garage alone, he felt a sudden, intense chest pain and started to fade. With no one around, he recalled a discussion we had about emergency measures. Using this technique, he fought to stay conscious until a neighbor noticed his distress and called 911. George later told me, "I was sure I wouldn't make it. Trying this gave me a shot." His experience shows why this knowledge can be a critical lifeline in the worst-case scenario. Here's how to perform this modified self-compression technique. If you sense you're about to pass out while waiting for help, lie down on a hard surface, like the floor. Avoid soft surfaces like beds or couches. Form a fist with one hand and place the knuckle side over the center of your chest, directly on your breastbone. Use your other hand to press the fist down firmly, compressing your chest about 2 inches. Then release. Aim for a steady rhythm of around 100 compressions per minute, which matches the tempo of the song "Stayin' Alive" from CPR training. Continue until paramedics arrive or you feel more stable. This method isn't as effective as proper CPR performed by someone else, but it may help move some blood to your heart and brain. If your heart's rhythm becomes dangerously irregular, why could this help? In a heart attack, your heart may struggle to pump blood effectively. This technique tries to mimic CPR's goal of circulating blood manually, though it's much less powerful. It's a desperate act for when you're alone and out of options. However, there are serious risks, especially for seniors. If you have osteoporosis or past rib injuries, pressing hard could cause fractures or other harm. Still, in a moment where the alternative is likely death from cardiac arrest, many experts agree it's a reasonable last effort. George's survival wasn't guaranteed by this technique alone, but it bought him precious time. I stress that this is not your first line of defense. Your focus should be on earlier steps, calling 911 immediately, taking aspirin if it's safe, positioning your body correctly, and using the breathing technique we discussed. This self-compression method is only for when you're at the edge and help hasn't reached you yet. In my practice, most patients who survived heart attacks did so because they acted quickly on those earlier steps, preventing the need for such extreme measures. Have you ever taken a CPR class or learned other emergency techniques, perhaps to help a loved one? Do you think seniors should be taught methods like this for dire situations? Share your thoughts in the comments below. Your perspective might encourage others to prepare or spark a valuable discussion. This technique is a final fallback, not a primary plan. The goal is always to get professional help as fast as possible. And every step before this one is designed to bridge the gap until paramedics arrive. In our next tip, we'll explore the most proactive thing you can do, creating a heart attack action plan long before you need it. It's about equipping yourself with a clear strategy so you can act without hesitation in a crisis. Stay with me to learn how to set up a plan that could save your life when you're alone. Tip 7. Prepare in advance. Create a heart attack action plan. During a heart attack, fear and pain can cloud your thinking. And for seniors, this confusion can be even more intense. A clear plan ensures you act quickly and correctly, even under stress, giving you the best chance to survive when you're alone. Let me tell you about Marion, a 77-year-old patient of mine. One night, while reading alone, she felt sudden fatigue and jaw pain. Because she had a detailed action plan, she didn't hesitate. She followed her steps like a checklist, and it saved her life. Marion later said, "Having that plan was like having a map in a storm. I didn't have to think, just do." Her story shows why preparation is your strongest defense. Here's how to build your personal heart attack action plan. First, make an emergency medical information card. Write down your name, age, medical conditions, medications, allergies, emergency contacts, and your doctor's details. Keep one in your wallet and another on your fridge, where paramedics often look. Second, store aspirin in easy-to-reach spots. Your kitchen, bedside, purse, or car. Use real aspirin, not other pain relievers. And choose non-coated tablets for quick chewing. Third, program emergency contacts into your phone with ICE before their names, like ICE daughter. Set up your phone's medical ID feature for first responders. Fourth, consider a medical alert device, like a pendant or smartwatch, with emergency calling. Fifth, make your house number visible with reflective markers, so ambulances can find you fast. Sixth, practice your response. Know where you'll sit, where your aspirin is, and how to unlock your door quickly. Finally, tell family or neighbors about your plan. If you live alone, arrange regular check-ins with someone. Another key step for seniors: talk to your doctor about keeping nitroglycerin if you have a heart condition. This prescription can improve blood flow during a heart attack. Review your plan every 6 months or when your health changes. Marion's plan included all these elements, and it made her response automatic, saving critical minutes. Let's look at Henry, a 71-year-old gardener who lived alone. One afternoon, while tending his roses, he felt unusual tiredness and back pressure. Thanks to our prior talks, he recognized these as heart attack signs. He stopped working, called 911, chewed an aspirin from his pocket, sat upright, and used the 4 to 7 -8 breathing technique. He'd also left his gate unlocked, a habit from his action plan. Paramedics arrived in 10 minutes and found a 95% blockage in a major artery. often called the widow maker, because Henry acted fast. He had minimal heart damage and was back gardening within months. He told me, "I never thought it'd happen to me, but that plan was my lifeline." Let's recap the 7 tips to survive a heart attack alone. First, recognize senior-specific warning signs like fatigue or jaw pain. Second, call 911 immediately. Don't drive. Third, chew 325 milligrams of aspirin if it's safe. Fourth, position yourself upright or recline based on symptoms. Fifth, use the 4 to 7 -8 breathing technique to stay calm. Sixth, try self-administered chest compressions only as a last resort. And seventh, create your action plan now. These steps, used together, can mean the difference between life and death. Have you made an emergency plan for yourself or a loved one? Share your experience or questions in the comments. It could help others prepare. Planning isn't about fear, it's about empowerment. In my 30 years as a cardiologist, I've seen preparation save countless lives. Take these steps today to protect yourself tomorrow. We've covered 7 vital steps to survive a heart attack alone. Spot warning signs. Call 911. Chew aspirin. Position smartly. Breathe with the 4 -7 to 8 method. Try self-compressions if desperate. And plan ahead. These can save your life. I'm Dr. Emily Harper, and I urge you to share this with loved ones. It might save them too. Like, subscribe, and comment which tip surprised you. Your preparation is power. Stay heart healthy, and I'll see you next time.